it. The rebate we give is 100%, so we give the products away. When we sell the same insulin in a commercial plan for Americans who have a job and have healthcare insurance via the employer, we get a significant higher price. And then over the past years, new insurance forms has come to the market in the US where you have deductible plans, so you're out of insurance coverage in the beginning of the year. And when patients find themselves in that period, they actually end up paying a very high price for the insulin, despite that we have already given rebates into the supply chain, but the patients do not get that rebate. So to answer your question, I think there is a big need for actually explaining to the population in the US what is the complexity of the healthcare system. Because I find very few Americans who actually understand it. And unless we understand how it works and what the complexities of it is, it's not going to change. And I actually think you could ask a lot of politicians, because a lot of them do not understand it either. And I have met a lot of them. And I'm a Dane. I've spent a lot of time understanding the US healthcare system. So I did a big town hall meeting in our company where I actually spoke to this. And one of my American colleagues came to me afterwards and said, "This is the first time I understand the US healthcare system." And it kind of blew me away that I had to come to the US in an employee meeting and talk to the complexity of the healthcare system for my American colleagues to actually understand it. That's a big problem. Because when systems get as complex as that, there are a lot of pain points for the people who actually need, the products and the services that comes out of that system. So if you could help us tear down the system to something that's simpler, I think that would be good for all Americans and for all patients who need the products that we produce.
Okay. We have another question over there.
Good morning, Jean-Luc Kaiserle from World Heart Federation. I was very pleased to see so many young people in the room, and I don't know if I should be included in these people, but this morning I felt like. My question would be for Luisa Brumana from UNICEF. It's about prevention of NCDs. As we know, diabetes 2 is a growing burden in many places. The cost for access to treatment is a burden for these countries and the governments, Minister of Finances. I was wondering what's your opinion in terms of prevention, taxation of unhealthy commodities, and how this budget could be found and allocated to treatment of NCDs, especially for children, because we know it's a burden issue for them. Thank you.
Sorry.
Thank you very much. And I think the question is spot on. You almost answered it yourself. I think I was mentioning before a few points, and I think it goes to what you just reworded very nicely. First of all, prevention is always more cost effective than care, and it's not just when you talk about NCDs. We know this is in general. So certainly what we are advocating for is to really make sure that preventive measures are there. And if you mainstream, and I was saying before, into existing maternal, neonatal and child health services, is definitely going to be cost effective. Now, you mentioned something else, and I know there is someone here that maybe would be even better than me in answering your question on taxation. Can I call you out on this one? Because definitely what we are looking at right now is really to looking at the discussion on what are the mechanisms and the laws that should be in place to protect children and adolescents in general. But I think you asked something that is more economically bound. Doug, can I ask you to intervene? I'm sorry, if you don't mind, I'll pass the word to our colleague from UNDP, Doug Webb, who's sitting. We are both part of the UN Interagency Task Force on NCDs, and this is his great area of expertise. Thank you, Doug.
Thanks, Luisa. I think the prevention is key. Ministries of health are stressed to finance universal health coverage, as well as combat the growing tide of NCDs. So domesticated financing of universal health coverage and the different conditions coming up through not only the health system but affecting the economies is where we're really moving to. So we are very concerned that there is not enough attention on sugar, tobacco and alcohol taxation as a key mechanism for governments to raise money and also have a preventative effect on health. So in this context, we are really looking at increasing sugar taxes, building on the great work that many countries have done, like Mexico, where there's been a measurable decrease in consumption, particularly in poorer communities and in young people. So the onus is on us to keep looking at the research, understanding its health impacts, and talking at events like this that there are solutions out there that we need to advocate. Because prevention is where we should be talking. Thanks.
And if I may add to this, I hope this shows you as well how we are really trying as UN in this moment to put our heads together and look at our different capacities to really come up with something that is useful.
So we have another question at that table, and then over there, and then the gentleman over there, and then a fourth one.
Thank you, and still good morning, and thank you to NCD Child and the government of Denmark to convene us in this breakfast. And thank you, Beatrice. It was fantastic to listen to you, and I think we need human voices. We still need to convince the powerful people in the world, including, I think, very, very welcome the Crown Princess of Denmark who listened to you. So thank you so much. But I would like to ask a question because, Luisa, I know you have a broad experience, and thank you for serving on the UN Interagency Task Force for many years, and also to contribute to some of the instruments that WHO have provided, like the Global Coordination Mechanism for NCD, where we really try to see and look how could we integrate, because you state the obvious, we should start even before our youth or elder people are born. We should start in the beginning, and we should actually apply a life course perspective. So from your sort of viewpoint, why are we not able to do that? And what needs to change? Do you have any ideas?
Thanks, Mette. A lot of very hard questions. I think these are the questions that governments and ministries should ask themselves, and we as UN and other stakeholders should help them do this reflection. I come from working previously on HIV, and that's another very important and eloquent example on how we have put a lot of attention on a very serious public health issue, but often we have done it in a parallel way than the services, and now 20 years later is doing us a big disservice, if you ask me. So I think there are some solutions that should be fairly easy, and in a way a lot of opportunities that can be taken without major shift on resources. And I was mentioning few. To have certain elements on counseling and health promotion within the existing maternal, neonatal and child health services should become a fact of life. And I think this piece is rather simple. I think probably we need a cultural shift, a cultural change from our own organizations, and you work for WHO, and we know that we are also somehow quite vertical ourselves, and that's what we are trying to promote within UNICEF, and I'm sure you're doing the same, but also being able to go together to governments and propose these solutions. I think I feel that in the last few years since when I'm working on this, change is happening, but I think not at the pace that we would like to see.
Good morning, everyone. Do you hear me?
No.
Thank you. Good morning, everyone, and thank you very much for this side event. My question is inspired very much by the award receivers, one of them said that we make our choices and we can always decide what way we will go, and that will influence also our life. And of course I agree very much, but at the same time I think that our choices are also really much influenced by the conditions we are born into, but also by the systems that are set around. And when it comes to non-communicable diseases, even though we often say that it's lifestyle, also lifestyle diseases, we know that the choices are influenced by the environment that we are having. And that's why my question would be